Hi, this is Dr. Pamela. We've been talking about when you've received a serious diagnosis, and in particular, how to make the most of your doctor's visits. One other thing that I want to discuss with you is hospitals. And the next few videos we'll talk about how to assess hospitals. But the first thing is to understand if you were to call 911, where would you be taken? It's in part dependent upon proximity and also if the service that you need is available at the hospital that is in that close proximity. Understanding the basics around this will be helpful to you and also will prevent any surprises if you're not taken to your favorite hospital at the time of an emergency. But if you're having an elective procedure or infusions for cancer or other serious conditions, you do have a choice of where you go. But you want to first make sure that you're covered by your insurance because not all hospitals take every type of insurance. And since it's a non-emergent basis, you want to make sure that you get the best coverage. You also want to ask your doctor if they have privileges at that hospital, if they see patients in the hospital. And then ask your friends, family, your dentist, which hospital they would go to if they were having care required in a hospital setting. One of the things that you can do to ask your doctor is which hospitals do they have privileges and do they see patients in the hospital if a patient of theirs was hospitalized. Not all physicians go to the hospital once a patient has been hospitalized. There's a handoff of care at that transition point. And it's important for you to know what that handoff is and that you feel confident in that process and that there aren't any surprises. By asking these questions, you'll be informed, which will help your hospital visit. Beyond an emergency, as you're considering which hospitals that you would like to receive care, you ask your doctor where they have privileges and also make sure that your insurance is taken at that particular hospital. But how do you determine quality? You can go to Medicare.gov, G-O-V, and look at their metrics. They look at quality, they look at patient safety, and they look at patient satisfaction. So Medicare.gov is a good beginning resource. But if you'd like more detail on how to evaluate which hospitals are best in your area, go to my website. It's free, and look at all the options for evaluating your local hospital.